made the jump feet first. It was deep water. As soon as I hit the water, it was like I got hit by a stun gun. And no pain, totally conscious, but I was frozen, couldn't move. I had been paralyzed from the neck down. The first thing I was thinking about was surviving because I was underwater for a while. I was, no exaggeration, probably a few seconds away from drowning before they turned me over. And the first thing I said was, I'm awake, because I thought, people thought that I was unconscious.
Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. Welcome to episode 21 of Boombostic Health. I'm Bradley Bostic, the host, and I am really excited about my guest today, Chris Leeuw. Chris, his story is absolutely unbelievable, and the most powerful part of his story is how he turned a personal tragedy, health-wise, into a thriving entrepreneurial success story. And the kind of adversity that you've navigated, Chris, it's just incredibly inspiring. In a 30-minute podcast, 20 to 30-minute podcast, it's impossible to cover all of it, but definitely want to get your story out there because I think the more people that know about it, the better. Chris is the founder of NeuroHope, which is a specialized healthcare provider that helps people who have had spinal cord injuries recover and really go through a pretty miraculous type of journey that is aligned with what Chris was able to do through his perseverance. Now, I'll offer a little bit of context for our relationship, but would love to have you fill in the story from your perspective. So Chris is a high performer and was an excellent student, came into a business that I had co-founded, which was called Cha-Cha, which in hindsight was kind of like what ChatGPT is. It was like ask any question and get the answer. The AI wasn't all there like it is now, but it was a cool business. And we grew really fast, and Chris was part of that story. He was one of our young team members. He was in his 20s at the time. And Chris went out for a fun trip with some buddies, as I recall, and we're in a quarry. Is that right?
We were kayaking. We were kayaking on a river in southern Indiana.
Oh, you were kayaking.
Yeah.
Okay.
Yeah.
So I didn't remember the facts correctly. So yeah, why don't you just take it from there? What happened?
Yeah. Well, thanks for having me on, and great to see you and talk to you again. And yeah, so kayaking with two of my best friends at the time. It was one of those hot, humid summer days in Indiana. And I was, when I was 28, I was very active, very athletic, did a lot of crazy stuff. And this was one of them. Not the kayaking part in general, but we came across a bridge about halfway down the trip that was over the river. And there were some people jumping off of that bridge into the water down below. And decided it'd be pretty fun to climb up to the very top of the truss of that bridge. This is where you may be thinking of the quarry.
Okay.
So I climbed up to the top of this truss, this beam, about 50 feet above the water, and just wanted to jump in, have some fun. And I'm standing on there, and when I tell the story, I always talk about how it felt like those construction pictures of New York City. You'll see the people with their lunch pails.
Yeah.
It was one of those types of beams way up there.
Wow.
And I'm just like, okay, I want to get off this beam and into the water. And someone who I didn't know called up to me, wanted to jump with me. And so I said, yeah, come on up. It's always fun to have a partner in crime. So he climbed up to that truss too. And we're standing there as close as you and I are together, like a foot away from each other. And counted to 3, made the jump feet first. It was deep water. And I can remember I'm falling toward the water, and I see the water, feeling the velocity of that fall. And then as soon as I hit the water, it was like I got hit by a stun gun. And no pain, totally conscious, but I was frozen, couldn't move. And I didn't know it at the time, but I had been paralyzed from the neck down. The first thing I was thinking about was surviving because I was underwater for a while. And eventually I sort of felt myself being righted, if that's the best way to describe it. I could kind of feel some of that the surface of the water, basically. But I'm still floating face down. I was, no exaggeration, probably a few seconds away from drowning before they turned me over. And the first thing I said was, I'm awake, because I thought, people thought that I was unconscious. So, but what happened was the guy that was standing there with me, we jumped at the same time, and witnesses said it looked as if I opened the hole up in the water. He came in directly on top of me and just landed on my top of my head, and just like a light switch, just broke my
Wow.
at the C4 cervical level. So, fortunate to be alive, fortunate I didn't drown in that moment, but then your life changes, they rushed me to, they airlifted me to Methodist Hospital in downtown Indianapolis, and, started to recognize the reality of the situation was that there was very little likelihood that I would ever regain any bit of movement, paralyzed from the neck down.
So when you were admitted and you were stable, was there a physician that came in and explained that to you?
Yeah, right off the bat, there was sort of some barrages of tests, and they knew it was a spinal cord injury. So I went to the MRI immediately, and I mean, I was a lifeguard before I got hurt. I knew what had happened too. I knew when I was laying there on the beach that it was bad, and it's a very surreal moment. It took a while for the shock to wear off. It didn't really hit me until I really woke up out of surgery the next morning, and then everything kind of rushed back, and you're staring at this reality of your life. Your life's over. In my mind, my life was over. So,
wow. Well, it's been so long since we've talked about this that I didn't recall all those details. In fact, I don't think I ever knew all of those details. I knew that the other person had landed on your head, but I didn't realize all the other facts and circumstances. So this is a tragic moment, and it just brings tears to your eyes thinking about that. And you could have just given up. Right? I mean, I bet a lot of people do. Like,
yeah,
you talk about
a lot of people.
The mind-body connection. You found something inside yourself where you said, no, I'm going to keep going. Like, how did that happen?
I think so. Within the first couple days of my injury, I started getting a little bit of sensation and a little bit of trace movement back.
Okay.
And I guess I want to preface by saying every spinal cord injury, every brain injury, every stroke, everything neurologically related, it's like a snowflake. Every injury is different. No recovery is the same. But the constant there is that every single one needs an incredibly long amount of time for rehabilitation. And I think in those first early days, I started getting a little bit of movement back, and I would really just gravitate to that. It would show me that there was something making its way through that injury on my spinal cord. So I said, okay, I can.
So you found some hope. You thought, okay, this is happening. I can feel these sensations. I can get better. You started to have some optimism.
Yeah, and that's all I could really grasp. That and the amazing support I had from friends and family that kind of really flooded the hospital and the rehabilitation hospital in those first several months. But it's scary because you don't know if that's all you're going to get back. But the first couple weeks, I remember I could flex the interior, I could flex my quads, and that's all I could do. But it showed me that, yeah, there was some communication there. Okay, there's some hope there. And then over those first several weeks that turned into months, I could start to unlock a little bit of movement very, very slowly. But I really noticed early on, that's when the whole second battle came was, healthcare is a problem for chronic injuries and really catastrophic injuries, because the cost of care stops relatively fast. I was in the rehab hospital for for several weeks, which is longer than most. But then, you're discharged and you don't have much left. I was in a nursing home then for another 4 months as I started to just recover from this catastrophic life-changing injury. And the void in care was the second odyssey I went on. It was the personal part, but then, okay, you assume you're in the right spot, you're going to get taken care of, but the reality is that there's a big void in care, and that's
so you start getting better, things are improving, and then insurance wasn't structured to continue supporting that. And so fast forward to today, and we'll fill in the middle of the story here. That's this amazing entrepreneurial success story. But to today, you now have a thriving business that you operate called NeuroHope that is both supported through donations as well as about half of it is actually paid for through insurance like CMS, Medicare. And there's still a lot of work to do, but you've gone from a young, everything is possible. And I remember you were super athletic. I remember that about you. You were really into being out doing things and fitness and then all of a sudden that all changes overnight. And not only did you persevere through to recovery for yourself, but you went on a personal mission to go create a better model for all of these other people that have these life-changing traumatic events, which is so incredibly inspiring. I want you to know that. Like, I know you get up every day fighting hard as an entrepreneur. It's really hard work. And I look at what I do and I think, man, I should never feel like I'm having a tough day, right? Like the things you've been through, it's just an amazing statement for what's possible when the human spirit really wants to do something. So, I mean, I just could not be more impressed with what you've done.
Well, thanks, Brad. I appreciate that very much. And yeah, it's spawned because of that void in care. So I could talk about it for an hour. I'll give you the Cliff's Notes version. But I left the nursing home and about 6 months after my injury, actually had recovered to the point where I could move my legs. I could move my right hand. Still have a lot of paralysis on my left side 15 years later, but traveled to a facility called NeuroWorks all the way in Utah that had this unique model that said these injuries need longer term access, not only to physical therapy and those professional clinicians, but also the resources to help maximize recovery. So as I spent 2 years at that facility rehabbing every single day. My mother was my caregiver at the time. And when I came back to Indianapolis 2 years later, being able to actually regain the ability to walk and get back to life, it said, okay, what's next? And I was so...
And that's when we reconnected.
That's when we reconnected. And you were fortunate enough at that point, HC1 had been launched. And I told you, leading up to this call that when you guys, it's like, what do you do next in life? Well, you guys kind of called me up and said, hey, there's a role here for you. So the work that I could kind of help out with HC1 in those early days is the reason why I could also then have some income again and start NeuroHope on the side. So eternally grateful for that.
Oh, you did great work for us too. So it was mutually beneficial. Yeah, I remember you were doing video work and things that you were able to do given some of the limitations physically, and you had your need to go do your rehab, and that was fine. It worked out well.
Yeah,
and I think it's tremendous to have you. That you were part of that team in our story at HC1, and also that you were able to go launch NeuroHope, that you developed this vision for. And you started it on your own.
From scratch, yeah. We started it. I started the nonprofit in 2013, but the point of it was, let's create a new model for healthcare, a truly patient-centric model, where we are an outpatient physical therapy, occupational therapy, and speech therapy clinic. But what's unique about us is that we also then offer affordable self-pay rates after insurance is up. So when you go through a spinal cord injury, you're in a rehab hospital for a certain amount of time. The irony is, in the 1970s and 80s, you were in the hospital longer than you are now. You get discharged even faster now. Now the average is between 10 to 12 days at the inpatient level. Then you have a certain amount of insurance-covered outpatient physical therapy visits, usually about 30 annually. It's not enough time to recover from a catastrophic injury. It's the same that you would have if you were recovering from an ACL tear. So the great irony is, as the cost of care, as interventions and the knowledge of neurorehabilitation advances, the cost of care also goes up, but the length of time to maximize recovery gets shorter and shorter. So not only are you not helping people, but another thing we're seeing is that 1 in 4 people with a spinal cord injury get readmitted back into the hospital system at least once per year because of other complications, skin breakdown, pressure sores, UTIs, things like that. So it's a very high cost population that costs the healthcare system millions of dollars, and we're saying, okay, if we can keep some of these people healthy, not only are we helping them in their recovery window, we're helping them in their long-term quality of life, and we're helping the healthcare system as well. So
Yeah, so you've studied this now, and it's clear that it costs less for insurance to help patients go through this type of rehab because it keeps them from being admitted into really expensive hospital stays. Is that fair?
in certain cases, sure. So again, they go by stats. So for me, for example, they looked at my injury, C4 spinal cord injury. At the time of my injury, I would have needed a $60,000 wheelchair to power with my mouth. So insurance was going to cover that because they looked at the stats, but they wouldn't cover any more rehab. So certainly there are some
So they
cases
pay $60,000 for the wheelchair,
because they want me out of the system.
but they wouldn't pay you $60,000. They wouldn't pay $60,000 to get you into rehab that actually allowed you to regain your mobility.
Correct. Yeah. And because I'm a statistic. Now, again, not every person with a spinal cord injury is going to make a recovery like me because you don't know, but it takes time. That's the constant, is it takes time. So one of the things that we launched a research study with the University of Indianapolis that was funded through the Indiana Department of Health that said, okay, let's see if we can take some of these high cost injuries and on the national average, are we actually lessening the reimbursement, the hospital readmission rates for some of these folks? And are we lessening the time that they stay in the hospital? And so far we've been doing it for 2 years and we're seeing that we are. It's a small subset, but it's working 50% less right now than the average spinal cord injury. The people that are participating in our extended care programs are hospitalized 50% less, and they stay in the hospital an average of 6 days, where the national average is 18. So, and it's not just spinal cord injury. It's stroke, brain injury, a lot of these chronic conditions. So I know in Indiana, I think 90% of the healthcare costs go to these chronic injuries. Now,
Really?
not spinal cord and brain injury, that's one subset of it, but you think about the cost of healthcare, it goes toward chronic long-term injuries, of which spinal cord injury is a subset of that. So, the population in general is, we're getting more unhealthy. And when you talk about folks that are sedentary, they need to stay active more than anyone.
And you're talking about chronic comprehensively, including diabetes? Is that included?
Yeah,
in
that
this
would be
number?
included in that.
Okay.
Yeah.
All right,
So
I get it.
So ours is a subset of that,
Right.
but the principle is the same. It's saying, right now there are so many chronic injuries, chronic conditions that as a, healthcare, we need to keep people healthy. So what are some ways we can do that?
Right.
And the healthcare system is so complex. NeuroHope is a solution for that subset where we're going to help people. We're going to have access to the best resources they can. We're going to have affordable access to that. And then we're going to continue to change lives.
So how many people do you think you've helped?
We helped our 600th person just recently this year. So we started in 2015. We've scaled several times. We had some.
So in 10 years, you've helped 600
over 600 people.
injured people
Yeah.
that if it weren't for you, they may have just been bedridden or in a expensive wheelchair without really hope to get better. Is that fair?
Some of them, certainly. There's a lot of folks that have had recoveries like mine that we've helped have that longer term care. Others, more chronic injuries, more complete injuries, keeping them active, keeping them healthy. One of the things that we've learned as we've grown is saying we want to help people beyond that recovery window. It's usually say about 2 years in stroke, spinal cord, brain injury, and say that next stage in life, keeping healthy long term. So one of the things that are particularly proud of now is that we've scaled many times over the course of the last 10 years. Our most recent partnership was with Sam Schmidt, paralyzed Indianapolis former IndyCar driver and a co-owner of Arrow McLaren Racing, former co-owner, and his foundation, Conquer Paralysis Now, exact same mission. Recently purchased the former Five Seasons building in Indianapolis, 110,000 square foot building.
That's a huge building.
Huge building, and it used to be a healthcare center. And so we're partnering with Conquer Paralysis Now to open the Driven Neuro Recovery Center, where NeuroHope is operating the clinical services there. So what we're doing there is robotics, neuro robotics, neuro electrical stimulation. We have an aquatic center. It's really making sure that the access to the resources are there long-term for folks. And we want to go beyond that too. We want to start adaptive sports programs, renovate some of the sports courts. So what we really want to do is change the community in Indianapolis for the disabled population, and so people can have an LA Fitness to call their own on top of a rehab center. So there's really a really open canvas of what we can do in Central Indiana.
So for someone with a spinal cord injury or another one of these injuries, stroke, and these issues that they need rehab for, do they have to be from Indiana, or do people come from all over to go to NeuroHope?
It's a good question. We've had people come from California, Illinois, Ohio. Most of the people right now, we have 160 people that we're treating right now. We have a wait list for the insurance side. But ultimately, it will certainly be a destination because there's no other place like what we're doing in the country, where there are a lot of facilities that have the personal training side. When you talk about a fitness center for folks with spinal cord injuries, and there's a lot of clinical sites that have the care for the physical therapy and occupational therapy. Ours is a hybrid. So we have that handoff from the skilled therapy to kinesiologists, personal trainers that understand neurologic conditions and can really be that handoff and that next step in care.
Okay.
So
does each patient have almost a concierge type of treatment where there's somebody who's helping make sure that each step along the way is going the way that it should? Or how do you organize that part in terms of, like, a primary care doctor in my world would be the one paying attention to, okay, you got the colonoscopy, you also went over and had whatever other type of treatment you might have needed, or some, you get your well check at your dermatologist. Is there that equivalent within NeuroHope?
That's a good question. So we have referral sources from physiatrists and in the community, and our clinical director, his name's Elliot Covey. He's an amazing physical therapist, and he sort of spearheads a lot of that care. So some of our patients will see us just for the insurance side and be under that care for PTOT speech. Some of them will be more personal training side. So I guess to answer your question, yes, they're all interrelated, and that's what's unique about it, is that there is more of a clear handoff, where when someone's therapy is up, it's not just home with a home health program. I mean, you're done with therapy, even if it's an ACL tear, you're done with therapy, here's some exercises you can do. No, they can stay in the building. They can still have care from the clinical team and work with other folks that really understand the injury. So it's that continuum of care that we really try to stress.
So the business of healthcare is huge, and that's a focus of our podcast, is really the situations where there's an economic engine that supports some kind of breakthrough innovation. And I heard a quote the other day. Somebody said, the United States is a healthcare business with an army. Like, that's basically, if you look at the numbers, what the country is. And I'm curious to know, with NeuroHope, is this a money-making kind of venture? Is it a business that could be this large enterprise? And I don't ask that in a way to be in any way controversial, because obviously this is about the mission. Mm-hmm. But if there's no margin, it's a lot harder to have a mission. So what do the economics look like here, and how do you create the kind of scale you'd like to create within those constraints?
So there's a reason why no one else does what we do. It's because it's not cost effective.
It's expensive.
So the way I look at it is that, when we look at ROI, there's a different level of ROI. Ours is purely for the patient.
Right.
So it does. I mean, so on average, when let's say you want to self-pay for a physical therapy visit after your 30 visits are capped at a traditional healthcare facility, most of those, to break even, will have to charge up to $300 or $400 per hour. That's not affordable for anyone, especially when you need a year of that. So right now we charge a little bit of a scale between $65 and $75 for that extra care, and then we need to fundraise to offset the cost. So the economics are a big part of what we do is fundraising. We do that through state grants, private grants, fundraisers, donors, corporate sponsors. But what I've learned is, over the last decade of doing this, is that when you really focus on the patient, there's just as much of a desire in the community to help lift up a social organization, a social enterprise, as there are for folks that are just looking at, an investment from a private, or maybe I shouldn't say just as much, but pretty equal. I mean, there's been overwhelming community support that have helped us scale over the last decade.
So how much of your budget is covered by donations versus by revenue?
About 50%.
Okay.
So about 50%, and that it kind of fluctuates. But
and are those donations, you go to neurohope.com and there's a link where you say you can give now, or how does that work?
Yep. So private donations, NeuroHope Wellness. If you just Google NeuroHope, it'll come up. .org. We have a donation page there, and it's a big part of what we do. So it's how we kind of move the needle and make it affordable. One of the things that is so unique about us is the interventions too. So I touched on them a little bit, and I could talk for an hour about it. I won't. But some of the high tech interventions, robotics, different type of treadmill training, traditional healthcare won't do it because you have to have multiple clinicians to properly operate it, and you need that longer term access for it to really maximize neural recovery. So their excuse is, well, if you're only going to get 30 days of insurance covered care, you need more than that, and we can't pull 4 clinicians off the floor, so we're not even going to offer this service. So to me, that's not an acceptable answer either. I mean, the interventions are out there. They're researching them in laboratories around the country. Let's get them in the clinics where they can help people.
Yeah, can you do studies that are funded by these companies that are coming up with those innovations?
We'd like to.
I just think about, as you're talking, I think about the promise of what's the company that Musk has that's in this neuro space. It's like
Neuralink. Yeah.
And there's some of what I've seen with that is people that have mobility challenges, and they have still the brain's connecting to nerves. They're just not getting the signal out. Is there hope that maybe at some point there's an ability to use technology to help reestablish those connections, or even some type of like an exoskeleton that would allow you to regain mobility that's connecting to the nerve signals?
Yes. Short answer, yes. I think, and what's unique about that is that, okay, even if this magic bullet to cure spinal cord injury happens tomorrow, you're going to need massive amounts of rehabilitation time for those folks to even utilize it properly. And the healthcare system right now isn't set up for that. So a lot of those, if they can embed a chip for the brain mapping to bypass that spinal cord injury and get to the peripheral nervous system, it still is going to take massive amounts of time to really have the care, the repetition, the activity to do that. And I believe, I hope that in my lifetime there will be some major grounds made in spinal cord injury recovery and the cure. Technology exponentially changes, and there's so much research going on. But
well, I think the understanding of how nerves work, and also the promise of AI and the promise of robotics, as you were bringing up, and the robotics will be, I believe that the next major transformational wave is going to be how robots are incorporated into every facet of life. And I think at some point you'll have robots that are keeping the streets clean and supporting law enforcement and also helping people who have spinal cord injuries. And so just as my entrepreneurial mind engages in this conversation with you, it seems like a NeuroHope Labs kind of concept could be pretty powerful, where you actually were actively engaging with the innovators that have promising capability. They need caregivers who are looking to take the next big leap, that want to incorporate those sorts of technologies into their delivery of care. They need it to get studied in order to ultimately get adopted and get paid for. I don't know, maybe there's something there. It sounds like you've already thought about that, but is there a flywheel that goes in parallel with, you've got conventional therapy you're helping people with that's already known, but then you have that next level that is coming. And I don't know, I just feel like maybe that's also a funding source and an opportunity to play a role in that acceleration of getting to, whether it's a cure or just a way to make it so that it's not such a catastrophic setback when you have a spinal cord injury or a stroke or whatever the issue is. I don't know.
Yeah.
I'm thinking out
Yeah,
loud.
right.
You can probably call me Captain Obvious. You probably already thought about this, but that seems exciting.
You're right, but there's no cookie cutter approach to this.
Yeah, because people are different, right?
Right. So there's so many different interventions. So there's a lot can be used in floor and mat work, traditional physical therapy. We still do plenty of that. We have aquatic therapy that we use a lot for the buoyancy to try to unweight some of that. We have a robotic exoskeleton over a treadmill that we use. We use different forms of neuromuscular electrical stimulation. There's some studies going on now about a different form of stimulation that you put the electrodes on the injury level and on the abdomen and try to target the circuitry of the spinal cord. I could go on and on, but you're exactly right. There are so many different avenues of neurorehabilitation in general. But again, going back to what I said earlier, the constant is you cannot properly maximize that in 30 outpatient visits. So what happens then? There has to be more programs in place like what we're doing that provides the access and the resources to maximize recovery, and then also provide a path to a healthier life long term.
Yeah. I would love to have a conversation over a coffee or a cold beverage of your choice sometime more about that opportunity to play bigger as it relates to playing that role and helping with the innovation. And I'd like to learn more too. I'd love to come visit your new location.
Anytime, open invitation. Yeah, if you've ever been in that Five Seasons.
Oh, I used to be a member. I was a member there. Yeah, I used to go work out in there, and yeah, I know it was kind of this sports country club was what they called it. And I think at some point it didn't have enough members or whatever, and so that the building was sitting there unoccupied.
110,000 square feet. So and again, like even for listeners that are maybe in the Indianapolis area, right now the top floor of that old building is 35,000 square feet that's empty. And what Conquer Paralysis Now and what we're trying to do is is try to find other tenants in there that are in the nonprofit world, in the healthcare world, to say, hey, let's make a campus. It's called the Driven Neuro Recovery Center. From Sam Schmidt and his what he has done for the spinal cord injury community over his 25 years post injury is phenomenal. And I'm so thankful that his nonprofit, which for years was trying to fund spinal cord injury research, he's wanted to take a portion of that now to help the cost of care with this facility. So we're really trying to do more in general.
Well, it sounds like a great partnership, and that makes a ton of sense in terms of a merger to unlock more value. And I would love to meet him at some point as well. He's inspiring as you are. So, well, unfortunately, our time is up. I really enjoy our conversations, Chris, and I am so thankful that I've been able to be part of your story, because it's an amazing story. It's one that, to me, is just a legendary example of what's possible when you set your mind to something. And I just expect that you're going to continue to do this. And I feel like the vision that you've started, when you look back 10 years from now or 15 years from now, this is going to be a pervasive model that is adopted in so many ways. And I think you'll help 10x the number of people that you've already helped. So thanks for all the great work you're doing to help so many people and be part of the positive change that's needed in healthcare.
That's the goal. And thank you. I appreciate it.
For sure, Chris. Well, now as we transition, we'll have Emily come on for the verdict, where we'll chat a bit more about the NeuroHope model and some of the things that relate to reimbursement, and also just generally how impressive and inspiring Chris Leeuw is. So we'll see you in a second. Well, welcome to The Verdict with Emily, where we're discussing NeuroHope, the brainchild of entrepreneur Chris Leeuw, who went through a traumatic spinal cord injury, and out of that has not only recovered physically in a miraculous way, but also has helped 600 people now and continues to grow. So, Emily, with your background in healthcare, you see a lot of dynamics as it relates to what gets paid for, what doesn't get paid for. How do you navigate this world of, you want to do the right thing by the patient, you would like to get paid for it if you could, but in many respects you can't, and are there ways that you can establish new payer paradigms? I know that this is not specifically what you do day to day. It's more of a billing and coding type of specialty, but I'm just curious your point of view, because it seems like it makes a lot of sense to keep people well and out of the hospital. I think Chris said it's 1 in 4 people who are recovering from a spinal cord injury get re-hospitalized, readmitted every year, and you can cut that dramatically, at least in half, by having them in these programs, which saves a lot of money. He also talked about when he came out of his injury, that insurance was going to pay for a $60,000 wheelchair that he could operate using his mouth, but not $60,000 for rehab. It's just kind of wacky because it's just all based on statistics. But just you see this stuff day in and day out from a different lens. Curious to get your point of view.
I do. So I think the biggest takeaway is what's clinically medically necessary doesn't comport with what payers determine to be medically necessary. And payers, as well as CPT guidance, I mean, I'm dealing with this with a litany of labs right now for molecular testing, right? What is clinically medically necessary and in the best interest of a patient? Payers have not caught up. So they don't understand, or maybe it's not they don't understand, they haven't actually taken the time to appreciate that maybe some additional testing that might cost more money on the front end is going to reduce costs further down the road. And it is a very frustrating situation because you have patients that are negatively impacted. Like in the case of NeuroHope, we're talking about these patients who need additional therapy, and it's not available because of reimbursement issues. And so providers aren't getting reimbursed. So there's a lack of desire to necessarily perform the services. Patients can't afford to pay out of pocket. And so they're stuck with these debilitating injuries. Whereas if the payers just understood this and realized, to his point, if we pay for certain services now, you're going to reduce negative outcomes later.
It's a statistical issue, it sounds like.
Sure.
And he was saying it's all numbers, and the payers, I do not fundamentally believe that payers are evil.
No.
But I think that there's an opportunity to reform the way the analysis is done to understand the impact on medical costs. And this reminds me of what we're doing at DecisionRx as it relates to medications, that if somebody's taking a cheap pill that's cheaper than the alternative pill, but that cheap pill doesn't really work well or even harms the person and they end up getting hospitalized one time, it's like a $3,500 to $7,000 event to the healthcare system, versus if they had a $500 pill that actually did work, that saved you that $7,000. But there's a lot of difficulty, I think, making those connections. I do believe with AI and modern data science, we're now getting closer to being able to model those more complex things, because all that's focused on, I think, is just the hard cost of how do we do less of a thing?
Right.
How do we justify doing less of this thing because that thing generates a cost right now, versus thinking about it as how does that connect to the eventual outcome? And in some cases, people bill for things in an inappropriate way, as in the eyes of the payer,
Right.
that even is viewed ultimately as,
Fraud.
I don't know, fraud.
Right.
And
Sometimes it's because there isn't a other alternative for billing, because there might be a generic CPT code or something. So it gets billed that way so that you're at least getting some sort of reimbursement. And the payers say, well, you're not supposed to bill that way. And then, Medicare starts investigating, and then the Department of Justice gets involved. And it's just really unfair. And I think the biggest solution to that is this focus on value-based care, which everybody has been talking about for 20, 30 years, and it hasn't gone anywhere. But maybe AI is going to help accelerate this switch from fee-for-service to value-based care.
I would not say it hasn't gone anywhere. We have a whole business that's focused on
Sure,
value-based
but it
care.
hasn't accelerated the way that we would like to see it happen.
It's not as pervasive as it should be. It's
Correct.
not. There are things that are possible now under value-based care, which is where the doctors get rewarded
Right.
for keeping people healthy
Exactly.
versus getting rewarded for doing more work. And I think that could apply with NeuroHope. If you could reward them for managing the care better, if on average in general it costs $20,000 a year, as just a number I pulled out of the sky, to take care of somebody who's recovering, and in the NeuroHope program that gets taken down to $10,000, wouldn't it be worth it to pay them the $10,000 to do that and then give them a bonus of $5,000? You still saved $5,000.
Right.
So maybe that is an opportunity. Maybe NeuroHope could develop a whole new value-based paradigm
Right.
for these kinds of injuries.
Yeah, I think it's
There's another idea. I mean,
just full of them.
I guarantee Chris already thought of that, but nonetheless will get on a whiteboard and pontificate about it. Well, that's pretty interesting. Well, thanks so much, Emily, for as always being here to cover the topics we're addressing. I'm just so thrilled that we had Chris on and that he's doing so well and he's thriving, because it was a tough road he's been down, and heck, building the world leader in helping people extend their care so they live better lives. There's nobody more qualified to do that than Chris. So really excited to see what he does from here.
Yeah, absolutely.
Well, thanks everybody for being here for Boombostic Health. We'll look forward to seeing you next week. Have a great day.